Hello, everyone. The research that I'll be discussing with you today is on lung cancer in America. I'll be sharing with you a concept map of what I will be focusing on today and the important points that I would like to highlight. Please take a look at the map, and if there are any questions that you have, let me know. I know this is not a typical presentation, so please send me an email if you have any questions or need clarifications. I will be happy to answer. Lung cancer is the leading cause of death in cancer patients compared to other cancers. Lungs are two spongy organs in our chest that take in oxygen when we inhale and release carbon dioxide when we exhale. Cancer is a disease in which cells in the body grow out of control. Lung cancer begins in the lungs and may spread to lymph nodes or other organs in the body, such as the brain. There is an estimated 5-year survival rate. Each year, millions of people die and the percentage just keeps on increasing. Smoking remains the predominant risk factor for lung cancer, but other factors such as secondhand smoke, genetics, and air pollution contribute to the death rate every year. Pre-existing non-management lung disease such as chronic obstructive pulmonary disease, idiopathic pulmonary fibrosis, and tuberculosis also are associated with increased lung cancer rates. Unfortunately, genetics plays a role in lung cancer. People with lung cancer who have never smoked may have a DNA mutation, such as a mutation in the epidermal growth factor receptor gene or other genes. Cancer caused by these mutations may be treated with targeted therapy. About 50 to 60% of lung cancers found in people who never smoked are adenocarcinomas. Smoking causes lung cancer by damaging the cells that line up the lungs. It is directly linked to lung cancer in 90% of women and 70% of men. There are people who think that if they are not the ones smoking, they won't get lung cancer. But according to research, every year, 3,000 adults die from exposure to secondhand smoke. Lung cancers are categorized as small cell carcinomas or non-small cell carcinoma. There are 4 major classifications of lung cancer, such as adenocarcinoma, squamous cell carcinoma, small cell carcinoma, and large cell sarcoma. The most aggressive sarcoma are small cell sarcoma. Although they respond to chemotherapy, by the time of diagnosis, the tumors are often advanced, which makes them more challenging to defeat. Treatments of lung cancer can vary because of different tumor types. There are different stages in cancer. Stages 1 to 3, non-small cell carcinoma, surgery is preferred. Advanced non-small cell sarcoma is treated with radiotherapy, chemotherapy, and palliative care. Individuals that have lung cancer can have different symptoms, but the most common symptoms are fatigue, cough, shortness of breath, chest discomfort, loss of appetite, hoarse voice, and edema. Edema is fluid retention and usually occurs in the feet. Treating lung cancer has been difficult, but now there are some treatments that can offer us some hope, such as immunotherapy. There has also been research on cancer vaccines which may help with defeating lung cancer. This is an ongoing research, but we are getting closer to our goal. I would like to discuss that in the past, immunotherapy treatments have failed. Although it's not exactly clear what the issue is, researchers have come to the conclusion that the reason why past immunotherapy treatments did not work would be due to lack of sufficient load of mutated tumor antigens. Some other reasons include due to suppressed APC traffic from tumors and lack of necessary signals such as CD40. This research has helped us with finding a way to improve immunotherapy treatments and gives us a better hope at defeating lung cancer. Now I would like to talk to you about cancer vaccines. There are different vaccines such as MAGA3 vaccine and TG4010 vaccine that target against different cancer classification categories, but the results were not as we had hoped. For MAGA3 vaccine, the placebo and the vaccine treatment did not show an increase in DFS in the vaccine group compared with placebo in either the overall population or in the patients who did not receive chemotherapy. Vaccines have not shown a significant activity in lung cancer. An attractive new approach is to take the personalized approach to immunotherapy by harnessing the power of gene sequencing. Every patient tumor is highly specific and carries a unique antigenic profile. It can be revealed by deep sequencing and immunology of mutated peptide predicted. These peptides can be used to track tumor-specific T-cell response and be incorporated into individual vaccine. In clinical practices, immunotherapy has become the most common treatment in treating lung cancer. Unfortunately, with every treatment or medication, there can be some side effects. But as I discussed earlier, we have come a long way in improving immunotherapy for lung cancer patients. There is a theory that screening and getting a routine chest radiography might help with survival rates. Although there has not been a study, it's an ongoing research that could save lives. At this time, screening is not recommended for everyone and should be discussed with your provider. Screening might be recommended for people who are long-term smokers. As much as we are trying to treat patients with lung cancer, there are some things we can do to encourage smokers to quit smoking. According to research, combining nicotine replacement, bupropion, and social or behavioral support can increase the quit rate to 35%. Informal counseling by physicians has also been shown to modestly increase quit rates. Some other factors that could contribute to decreasing lung cancer include getting a good diet with fruits and vegetables, exercising a couple days a week, testing home for radiation, and reducing minor access to tobacco products and e-cigarettes. Education is another important factor that can contribute to decreasing lung cancers. I am hopeful that in the future we can beat lung cancer and find treatments that will cure the disease. Technology is improving every day, and I'm sure if we asked the older generations if they ever thought technology would get here, they would say no. There are some incredible things we can do with technology. Thank you for taking the time to participate in my research. Have a wonderful day. Thank you.